अमरिंदर से आवाज आ रही है?
Very
Hello
good evening
everyone,
to
thank you
all.
for joining. We will start in 2 minutes. Let others also join.
Uh, Very good evening to all respected doctors and all the participants. Kenneth, if I'm audible, can you confirm me if my voice is audible? Fine.
Audible, sir.
Yes,
Thank you.
Okay.
audible.
Thank you so much for confirming me. Uh, so the overall agenda of keeping this call, so giving a brief idea about the new initiative that has been taken up by the National Health Authority, which is Clinical Decision Support System. So this is the product which has developed by the AIMS team, and now National Health Authority is supporting on the integration part and the adoption part. On the integration side, we have completed the integration with. I just request all to keep on mute. Okay, thanks. So on the part of the integration, we have completed with the NIC Next Gen, which is working in all the facility, across all the facility with the available solution of the clinical decision support system. So the integration has already been done. We are getting the transaction and the recommendation from the NIC platform as well. So they are using it from past few months. The agenda is to giving you a brief and giving an idea how the CDSS is getting developed, what kind of benefit the doctor would have, what kind of benefit the hospital, the patient would have. So we have the NHA team. I'm Dr. Amardeep. Along with me, we have Mr. Kenneth and Kritika. We are leading this track from the National Health Authority side. We also have the CDSS tech team, Dr. Dev. He is the CEO of the ClinLI. Uh, Dr. Mukad, Mr. Tejas, and Mr. Bharat. So this CDSS is being rolled out. We got the MOU signed with AIMS last year on 28th of June. Till we have started the integration part, and we are in the process of it, getting more adoption of the CDSS. We're getting a very wealthy number of uh, from the NIC next gen solution, and it is using across in many states. So this journey gets started with as a part of the research which has been done by the AIMS in the South Asia, and they have come up with the outcome of lowering down in the disease with management of the patient by identifying the high risk patient, getting the patient specific and the evidence based recommendation from the CDSS module. This is not an AI module. This is a rule based algorithm which will be helping doctors to make a good decision over the patient's well-being. NHA is always looking up for what if the new innovative solution, and one such solution is a CDSS, which has been developed by the AIMS team, and now we are helping for the adoption part. So we would be covering uh, the presentation mode on the CDSS part. After that, we'll run a small demonstration on the NIC platform, which will give you a good idea how, as a doctor, uh, as a clinician, how you can use this CDSS module within your HMIS to get the patient specific recommendation, and definitely it will be helpful for you to get the drug recommendation, the treatment recommendation, the lifestyle advices also from the CDSS platform, and automatically it will be come up on your prescription. It would take a 1 minute to use the CDSS as an additional module for you to get an assistive uh, thing to the doctors. So we'll start with the presentation mode. Then we'll take a demonstration on the NIC. We'll give you a live demonstration. And the third, we will be covering a QA session, which is a question and answer. You can raise your query. You can raise your concern over based on today's training. In the future, we will try to have some more trainings and some more workshop to give you an update over the CDSS, and we'll try to make a more familiar on this product. I would like to request Dr. Dev from the CDSS tech team to take this up ahead on the presentation mode and on the demonstration part. Dr. Dev and team, over to you. Thank you so much.
Thank you, Dr. Amardeep. So as Dr. Amardeep said, we'll start with an overview of clinical decision support system, followed by a demonstration of next-gen platform with clinical decision support system, and then we'll be open for the queries. I will request my colleague Dr. Mukut to start the presentation. Thank you.
Thank you, sir. Dr. Amardeep, I have requested the screen sharing rights, if you can just allow it.
Give me a minute.
Allowed, please go ahead.
Thank you. So I'll be sharing my screen. Is my screen visible to everyone?
Yes, sir,
Yes,
it is
okay.
visible.
Thank you. So like Dr. Amardeep said, we are talking about the clinical decision support system. In short, we are calling it CDSS. So in this presentation, we'll talk about CDSS, what is CDSS, why there is a need for CDSS, and the kind of research which has gone behind developing the CDSS, and the impact it creates in the current healthcare scenario. Then we'll talk about the benefits of CDSS, and then finally we'll talk about the workflow. So CDSS is a computer-based program basically developed to help doctors in order to come to the best treatment recommendations, to derive the best treatment recommendations basis whatever records, whatever data they're capturing in their electronic health records. It improves the efficiency, reduces errors and adverse events, and enhances the overall quality. CDSS is a worldwide phenomena. It has been adopted by CDC USA as a best practice. So this, like I said, this is the first ever CDSS that has been developed for hypertension and diabetes in India. And this effort has been jointly led by All India Institute of Medical Sciences and Center for Chronic Disease Control, CCDC India. So first question is why there is a need for CDSS, why there is a need of CDSS for diabetes and hypertension. Like you can see on my screen, for the first time, WHO has given 5 targets for diabetes by the year 2030. The first is 80% of people living with diabetes are diagnosed. Out of these 80% should have good glycemic control. And 80% of people who are already diagnosed with diabetes must have their blood pressure under control. And then 60% of people with diagnosis with diabetes of 40 years or above should receive statins. And 100% of people with type 1 diabetes should have access to affordable insulin and self-monitoring blood glucose. Desir, if you'd like to come on this slide.
So definitely there is a need worldwide to tackle the prevalence of diabetes. That's why WHO has come up with definitive goals. But if you look at the situation in India as well, the prevalence of diabetes in India is increasing. So these two maps are showing the prevalence of diabetes in India in 1990s and 2016. Now we're in 2025. So the prevalence has gone up. If you look at the left-hand side of the graph, most of the states, they have less than 5% of the diabetes prevalence. But if you look at the right-hand side of the graph, now most of the states have higher prevalence of diabetes. So the graph is going up in terms of prevalence of diabetes among Indians. Next slide. Similarly, if you look at the hypertension, the burden of hypertension, like we know, even in our families or around friends, everyone must be having 1 or 2 patients of hypertension, high blood pressure in their family. But the other shocking facts are only 25% of the people are aware about their condition. So out of 100, only 25% people, they know that they have hypertension. And out of those 25%, only 25% receive the treatment. And people who are getting the treatment, only 10% are achieving the blood pressure control. So there are scope of multiple factors that we can utilize to improve the overall care for hypertension and diabetes. And this slide again shows the prevalence of diabetes and hypertension. And there is a general rule for hypertension and diabetes. This is a rule of halves. So only 50% of the people are get diagnosed. And out of 50%, generally only 50% receive the treatment. And people who receive the treatment, only 50% achieve the controls. So, and out of those 50%, again, then another 50% achieve the desired outcomes. So if we start from 100, I think only 5 people are getting or 10 people are getting the actual treatment that they deserve. And more than 300 people are affected by diabetes and hypertension in India. So next slide. So what clinical decision support system does is that it acts as a bridge between the healthcare provider and the patient. So even Dr. Mokat, when he was talking about the definition of clinical decision support system, we have highlighted the word assisted. So clinical decision support system is actually a virtual assistant for the doctor, because we know that our doctors in India, they are busy with so many patients and they have so many responsibilities. So with the concept of this technology and task sharing, so these some of the factors can be addressed, and clinical decision support system can help the doctors in providing evidence-based care to their patient for CVDs and diabetes. And it just gives the recommendation to the doctor in a very user-friendly way. Next slide. So now we are going to talk about some of the work that we have done. So this slide is very important because um, although this technology is worldwide known, and it's not something that AIMS team have copied from somewhere and is given to our doctors in India. A thorough research has been done by the researcher from AIMS, CCDC, and other prestigious organizations. As you can see, our work started in 2010. We have done the implementation of clinical decision support system in the tertiary care centers, community level, primary care level. Then two state governments, they adopted clinical decision support system for some period of time. Then it became part of the National Program for Non-Communicable Diseases. WHO also adopted the clinical decision support system developed by our team. Now NHA is offering the clinical decision support system to the ABDM compliant platforms. That's why today we all are here. Next slide. So the previous slide was about the kind of work this team has done, but this slide talks about the clinical outcomes. So these are the results from one of the study that was done by our team in Himachal Pradesh. So clinical decision support system was implemented in 6 government settings, 6 outpatient clinics. Around 21,000 patients were screened during that period of time, and 6,800 patients were having hypertension and diabetes. So these are the patients who were just visiting the clinics, like they were coming there for their general complaints, maybe fever or some sort of illness. But since we were using a technology there, we were able to treat 6,800 patients with hypertension and diabetes. And out of 6,800, approximately 50% were not aware about their condition. So they were visiting the hospital for something else, but because of the software, a doctor and the healthcare providers there, they were able to tell the patients that, okay, you have hypertension or diabetes as well. And diagnosis is just one part. Then also what we were able to achieve was the reduction in their blood pressure values and the blood sugar values. And if you look at the graphs on the right hand side, not only we were able to achieve the reduction, we were also able to sustain the reduction throughout the study period. Next slide. Similarly, when we implemented the clinical decision support system in the tertiary care settings, where the specialized doctors, cardiologists, endocrinologists, they were available, even their clinical decision support system made a huge impact. So what you see in this graph is where the specialist doctor, they did not accept the CDSS prompts. The mean HbA1c value for those patients were 8.6. But when more the doctors, they accepted the CDSS prompts, there was seen the reduction in the value, HbA1c value, systolic blood pressure value, and LDL values. So clinical decision support system is effective irrespective whether we are using it in the PSC, CSC, or at the district hospital. So it is effective, it is useful everywhere. Next slide. So from the clinical point of view, reduction in blood pressure and reduction in blood sugar value is definitely important. But from the patient point of view, what we want is to have less number of any microvascular or macrovascular events. So like we don't want their eyes to get affected, we don't want their kidneys to get affected. So this is one of the latest study done by our team, and the results have been published last year only. And where we did the follow-up of the patients for 6.5 years. And what we have seen, if we use the clinical decision support system, patients coming to these clinics, they experience less microvascular events. So this is the hard clinical outcome of using the technology in the clinical settings. Next slide. So the reason why we were talking about the research and impact, so that we can build your trust. So there is a lot of work that has been already done. A lot of changes have been done, and now this technology is here available for everyone. So again, this is to assist our doctors, this is to empower our healthcare professionals so that we can provide better, personalized, and safe care to our patients. So, what clinical decision support system does, it provides the personalized clinical management plan. So, based on the patient parameters, it gives what drug should be given, what should be the dosage. It gives the prompts about whether we need to increase the drug or we need to decrease the drug, we need to add another class of drug. It also gives the alerts on contraindication. And it's very easy to read, like it doesn't prompt an article or it doesn't prompt a guideline to the doctor where the doctor needs to spend 15-20 minutes. It just gives a kind of drug name, contraindication, dosage. So it hardly takes 30 seconds to 1 minute to read and understand what the clinical profile of the patient is and what the CDSS is talking about. So since we are offering clinical decision support system for diabetes and hypertension, so next two slides are mainly talking about how it works. So when we talk about the diabetes, what it recommends is it either recommends the oral hypoglycemic agents, which includes all our drugs, metformin, sulfonylurea, pioglitazone, etc., and insulin based on the patient profile. So it also gives the prompts about the insulin, when to start the insulin, how to increase or decrease the insulin. Also, it helps the doctor in adding another class of the drug or down titration of the drug doses if the blood sugar is too low. It also helps the doctor in diagnosing the new and high risk patients. While giving the recommendation, it also consider comorbidities like kidney disease or heart disease. And one of the other important thing, it also consider real world challenges. Ideally, when we are treating a patient with diabetes, we want to have their HbA1c value, we want to have their fasting blood sugar value or ppg values, but sometimes it's not possible. Most of the time in our clinics, especially at the PSC level, we have random blood glucose values available. So even if we enter random blood glucose, it will give you the recommendation. If we have more information about the patient, it will give a better recommendation to the healthcare provider. And also there is one thing to note, this query we get multiple times. This clinical decision support system is for type 2 diabetes mellitus. It is not for type 1 diabetes and gestational diabetes. Next slide. Similarly, for hypertension, it helps in diagnosing the patient who are at high risk. Then while giving the recommendation, it also consider comorbidities like kidney disease, COPD, asthma, heart disease, etc. It also gives the prompts for lipids and statins when required. And when we give the treatment plan, it also consider whether the patient is already taking any drug or not. If someone is taking any drug which is contraindicated, it will tell the doctor, and it will also consider what dosage of the drug is being taken by the patient before giving any recommendation. And it also provides alerts on contraindication and lifestyle. Next slide. As I said in one of our slide, it has been adopted by many state and the national government. So clinical decision support system is also part of operational guidelines, which was recently launched by Ministry of Health in 2023 for the National Program for Non-Communicable Diseases. Next slide. Similarly, WHO also adopted clinical decision support system by our team to use this engine for PAN guidelines, and this CDSS was implemented in Maldives. Next slide. World Heart Federation launched a roadmap for digital health in cardiology, and our clinical decision support system featured as one of the successful case studies in that roadmap. Next slide. Similarly, United Nations also launched a future lab pocket on different intervention and different technologies, and our clinical decision support system again was selected as one of the case studies. So it shows not only the national agencies, in fact, the international organizations have given the recognition and awards to this technology developed by AIMS and CCDC. Yeah, next slide. So this is the usual workflow which works. So for example, when a patient comes to your clinic, first they will go to the registration desk. If they have ABHA will be used, or ABHA will be created, and then the patient goes to a nurse. Nurse checks their height, weight, takes some initial medical history, what drug they are taking, and all the data is being entered into your platform. So there is nothing new that a nurse or a doctor has to capture. It is the same flow which is already happening in the clinic. Only thing is that with the clinical decision support system, we just want to make sure that certain questions are being asked to each patient. And once the nurse has done the assessment, CDSS assess the clinical parameters. It doesn't require any of the patient identifiers. It doesn't need patient phone number, mobile number, or their name, etc. It just needs their clinical parameters. And in the real time, it gives the recommendation back to the doctor. Doctor can see what the CDSS is recommending, but the final prescription will be given by a doctor only. So CDSS, as I said, it is just a virtual assistant for the doctor. It does not give any prescription. It just gives the recommendation. A doctor can take the final decision what drug they want to prescribe to their patient. Thank you. So we'll share these slides. One other comment we received that if we can share these slides, we'll definitely share these slides. We'll go with the demo and then we can open to the question and answer. Dr. Muket.
Yeah, just allow me 1 minute, sir. I'll just share my screen and I'll start the demo.
Thanks so much, Dr. Dev, for giving a good insight through the presentation mode. We'll start by the demonstration, then we'll take all the queries from all the participants. Post this training session, we'll be sharing the presentation with all the hospitals. Thank you.
I hope my screen is visible.
Yes, this is visible.
Yeah, so this is a next-gen portal. It's an NIC platform.
So just wanted to give you an update to all the participants that this feature is already being available on the next gen solution. So this demonstration will give you a fair idea how you can use the CDSS for getting the recommendations. Thanks.
I'll just take a minute. I'll just share my screen in a minute.
No problem.
So I'll quickly start with a registration process. I'll register one new patient. I'm taking age as 46 years. Patient is resident of Agra. So I've registered a new patient. Here I can see my patient, number 4. Now I'm on the initial assessment screen. We call it examination. I'll randomly put numbers here. Now I'm going to put high value of blood pressure. I'm taking random blood sugar as 400. I'm saving these vitals. Now I'll go to the diagnosis screen. Here I'll ask for the CDSS recommendation. So the CDSS says, based on the values I input, patient is diabetic as well as hypertensive. Now I'll go to the medication part. Again, we have a tab here called to fetch the CDSS recommendations. Now here is the CDSS recommendation. First, on the left side, we have hypertension is yes. Patient has stage 2 hypertension, and the recommended action is a pharmacological treatment. And we have the drug recommendation as well. I have 3 options to choose from. I can choose any option. Option 1, option 2, option 3.
So
Similarly,
if you look at the screen, for a doctor, it's very easy to understand that, okay, this patient has hypertension and diabetes. We need to start the drugs, and these are the options. So in case of hypertension, there are 3 options, but in case of diabetes, there is 1 option. And within the 3 options, we are just talking about the generic drugs and drug class. So doctor can recommend whatever drug they have available in their clinic. It doesn't bound the doctor to recommend a specific brand name. So if there is any contraindication, it will come here as well. But in this case, there is no contraindication. It's a very simple case that we have shown. Yeah, Dr. Mukul.
so similarly on the right side, we have a diagnosis for treatment, a diagnosis for diabetes. It says diabetes is yes. Pharmacological treatment is recommended. And CDSS is recommending to add metformin 1500 milligram.
Sir, I have one question.
Yes,
Hello?
please. We have open house for questions now. Yeah, we can start with a Q&A session. Dr. Madip, am I audible?
Yes, Dr. Mugut, you're audible.
So that's it from
So,
my side. I'm done with the presentation and the demo. Now I think we can start with our question and answers.
Hello,
Yes.
sir. I am Harendra Kumar from Jharkhand, ABDM Jharkhand team. Actually, I have one question that CDSS is providing some recommendation from the medicine which is available in store. If I select the medicine which is not available in store, then will it provide the recommendations randomly?
Dev sir, if you would like to answer this question.
So Harendraji, it is not providing the recommendation based on the drug available in the store. It
Okay,
is providing the recommendation based on the patient clinical profile, what patient requires.
okay,
But but it is giving the medicine name as per the Indian Public Health Standard. We are not using any brand name. Most of the time, drug recommended by the CDSS, like if you remember the example which Dr. Mukat was giving, within a class, we have given 3 or 4 examples of generic drug. So if not one generic drug is available, then other generic drug should be available. Yeah. So, but the important factor is it gives a kind of an idea what kind of drug, what dosage, what kind of combination should be given, what are the contraindications. So doctor can look at it and then based on the availability what they have in the clinic, in the facility, they can give those medication to the patient.
okay, sir. My second question is, while doctor is typing medicine, then some recommendation are populating in drop down box. I think it is also coming from CDSS. And same thing happening from ICD-10, I think, integration. I'm not very much sure, but I'm just want to ensure from your side, ICD-10 or ICD-11. So what is the basic difference in CDSS and ICD-10
So,
integration?
so CDSS is basically both are separate thing.
Okay,
ICD-10 is a nomenclature. Okay, it is being used so that we have a database of the drug or whatever information we are capturing about the patient in a standardized format. It has
okay,
nothing to do with the clinical decision support system. The drugs that you might be seeing while you are having a drop down is because it might be linked to your local drug availability. CDSS is purely based on the patient clinical parameters. CDSS is just a tool for the doctor to see, okay, what should be the treatment plan for the patient based on latest guideline. It is just an assistant for the doctor. It is not a nomenclature. It is not a like a local drug availability checker. So it is just both are separate things. I hope I have answered your question.
Okay. Thank you, sir. So is it integrated with e-Susurt HMIS? Because we are implementing in Jharkhand is
Yes,
Susurt
sir.
HMI.
Dr.
Correct, sir.
Mandeep.
So this has been integrated with eShushruut Clinical Lite, which is a light version of CDAC. So on
Okay.
the government side, we have integrated with NIC NextGen along with eShushruut Lite, which is a light version of the CDAC. So it is live.
Oh,
The only thing you need to start it and getting those recommendations.
okay. One last question that is it has any version like ICD-10, 11, CDSS version?
So we keep updating the CDSS based on the latest guidelines. But the
Okay.
ICD version that you're talking about, it's more again a nomenclature versions that they have. And but CDSS is also being getting updated based on the if there is any latest guideline changes. For example, if there is a new class of drug being added for hypertension or diabetes, it will reflect in your CDSS recommendation.
Okay, sir. Okay. Thank you, sir.
Mr. Hirendraji, just giving an answer of your previous query, we are also thinking of to go ahead with this CDAC e-Shushruth HMIS. We already
Yes, sir.
integrated with the e-Shushruth Lite. We are also thinking to get on board e-Shushruth. If you're using, if any hospitals are using the e-Shushruth platform, uh, not the e-Shushruth Lite, but the main version of the e-Shushruth HMIS, they can raise a request to the CDAC team if that feature can be available for them, so that the doctors who are using the CDAC platform, they would also be able to use CDSS module. So we are in the process. We are thinking to get CDAC on board. Once it's get completed, we'll update all the partners. Till that time, you can also raise a request to the CDAC if you want to use
Okay,
this
sir. Definitely, I will
CDSS.
raise the request from my side to CDAC. But I would like to know
Thank you,
one
sir.
thing, that how much time it will take to integrate your CDSS with CDAC HMIS.
Sir, not more than 2 weeks. 2 weeks consuming API, reading all the postman collection document, get the integration support, giving you a demonstration demo, and take a production key. Not more than 14 days. If the dedicated team would work upon the CDSS integration, it would not take more than 14 days. 14 days of working days of a 10 days comprises of 2 weeks.
Okay,
We'll
okay, sir.
give you
Thank you, sir.
extensive support. We have an entire team for the the CDSS tech support. So the extensive support can be given, and all the partners they actually completed the integration within these timeline only. So there are almost 14 integrators who already get onboarded on the CDSS, comprises of government and the private partners. So not more
Okay,
time. So it will take
okay,
only
okay,
14 days.
okay, sir. Thank you, sir. Thank you.
Sir, very good afternoon. I'm Dr. Anjana Sana from ABDM Jharkhand. I wanted to know, is CDSS being run and accepted in some other states? Do we have any examples of states where CDSS is being followed?
Yes, exactly. Definitely, ma'am. Ma'am, it is well accepted by many of the states. UP, Maharashtra, Chhattisgarh. So there are a couple of even we got the transaction from the Meghalaya as well from the northeast. So there are a couple of Karnataka, Andhra. So there are a couple of states you have already started using this solution, and Chandigarh, Chhattisgarh, Maharashtra, Telangana, Andhra Pradesh, Karnataka, Meghalaya. So there are a couple of good states they already started using, and we already got the recommendations alerts, the transaction on the dashboard. We have made the dashboard also separately for the CDSS. So we are getting the transaction details. Almost, I'm happy to share the insight over the NIC. We are very close for the 50,000 recommendation. It is 49,700 till date we have recorded the transaction from the NIC Next Gen. So it is live. It is getting using by all the doctors.
Okay. Thank you so
And
much, sir.
and reason
Yes, sir.
why, ma'am, we are giving a training so that you would also be aware of that this kind of feature is available on your HMIS, so that you will start using it.
True. Thank you so much, sir.
And for the initially, we have taken model health facility because this is a concept, this is objective for the model health facility, because we want them to the end-to-end digitized, so that each and every initiative will be used by the model health facility. So that is why we have taken model health facility first. Then we will start the training session for separate states also. Similarly, we will also send you a request for a similar kind of training on CDSS state-wise very soon.
So this training will be jointly attended by PMU teams and doctors also?
Yes, it is all up to you. We want if the PMU, HMIS expert, doctors can also join this training session. So I think next week would be for the festival. I think from next week, we will be starting a state-wise training, and
Okay.
we'll give you again a kind of repeated training for you. This is primarily for the model health facility. So next week onwards, we will start with states. So we
Great.
will
Thank you so much.
cover all the
Yes.
36 states along with the youth.
Okay. Okay. Thank you so much.
No problem, bro. Any other query, any other clarification? I think I have heard about the medication. So whatever the recommendation we are getting from the CDSS platform, it is these are the basic drugs that need to be available in your HMIS. So don't worry about the recommendation if it is out of stock or not. Definitely it won't be out of stock. So whatever the transaction, whatever the recommendation we are getting from the CDSS, those drugs are the very minimal and the basic drug that must be available in your HMIS. So don't worry about if it is not available in your masters or in your inventory. So that will be present.
Hello, sir. Maninder this side from ABDM Punjab.
Good evening.
Good evening, sir. Maninder this side. Am I audible?
Yes, you're audible.
So, sir, I have a small query, although I am not a doctor, but I have a query. Like you have demonstrated one thing, the patient has been shown diabetic and hypertension as well. So, CDSS has recommended a medication. So, on next visit, if his other reports or vital reports, blood reports are shared, will it give go into deep analysis as well?
Yes,
Detailed
it will consider what the patient is currently taking, what is the current value of the parameter. For example, if the blood sugar is still under control, or it has gone up, or it has gone down, and accordingly it will give the recommendation.
Okay, sir. And one more thing, sir, like in digital health communication or in AI-based models, there is one thing that is still being discussed about trust and equity in
Yeah,
AI-based
yeah,
models.
yeah.
So, what are the measurements that we are taking in CDSS in terms of trust and equity? Like this is a race blind model, or we are taking into consideration the cultural things, or the lifestyle, or the things like we have various types of lifestyle options available in India. If we move from one state to another, lifestyle changes. So will it take those things into consideration as well?
So couple of things. One is, in the beginning, also Dr. Amardeep mentioned, it is a knowledge-based, rule-based clinical decision support system. So it runs on the latest clinical guidelines. So whatever is being recommended by CDSS, it is 100% based on the latest scientific evidence. So there is no scope of wrongly data-driven recommendation. So it doesn't look at the large data sets and give the recommendation. So it is not purely data-driven AI engine. So it runs against the guidelines. So trust of the medical community is there. Whatever the drug, whatever the recommendations given by CDSS, if you check with any specialized doctor and if you ask them whether the latest guidelines also give the same recommendation, the answer would be yes. Second is, these recommendations are also tailored as per the ICMR guidelines and as per the Indian Public Health Standard. I'm talking about purely the clinical management plan when we are giving the recommendation for drugs, their dosage, and contraindication. Now, for the lifestyle advice, as of now, we are giving the general lifestyle advice, which are still very important for the patient. Like, okay, for example, take your drugs on time or do physical activities, but it is not considering the local factors while giving the recommendation. So when we will say, okay, eat fruit or healthy food options, We are not talking about what fruits are available in that specific state. So some sort of local customization might come in the future.
Okay, sir. Okay, thank you.
Anil, for example, as far as the lifestyle advice is concerned, if a patient is hypertensive, definitely doctor want you to lower down your salt. So it may not impact much if you're migrating from one place to another place. Just need to follow up the instruction given by the doctors through the CDSS, lower down your salt, getting a brisk walk, a small 30-minute exercise. These kind of recommendation as a lifestyle advice that you can continue if you're migrating with the different geographical location. So it just and sometime the lifestyle advice would be given from the system where when the medication may not be required. If you're prone to become a diabetic, but you're not diabetic, the doctor would not want you to prescribe a medicine. They definitely want you to take up on the lifestyle advices. Based on that, if you're okay, if you're fine to stick with the recommendation, the lifestyle advices. Otherwise, if some patient is developing the high BP or a high sugar, the doctor definitely want that patient to lower down through a medication. But these are the very minimal, very basics which usually given by the doctors to lower down salt, start doing the exercise for the 30 minutes, taking fruits, cut down the diet. So lower down the taking a fat or a lipid through your diet. So these can be maintained if you are migrating yourself from different regions. So that would not impact much on your health if you are migrating.
Okay, sir. Thank you for the clarification and thank you.
Okay. So I think the prime things is raising on the chat is sharing the presentation. Definitely, it will be shared by the state coordination team. Uh, Post this session, we will be circulating the updated presentation. And also, I'm sharing the email address. We have made the dedicated email address for CDSS. If you have any query, you can write it down to us. And this is all also being mentioned on the presentation. Any other query from any other doctors, any participant from the respective states? If they want any clarification on the CDSS. The objective is to give you a brief about the CDSS so that you can start using it and getting a benefit from this module. As you have seen what Dr. Mukhat have shown you over the demonstration part, it won't take a minute to get the recommendation. It will be assistive, but definitely a benefit for the doctor getting assistive recommendation. Now it's all up to the doctors whether they want to take this up or not. So, but within the time limit, within that 1 minute time limit, they will get the recommendation and they can choose the drugs, kind of the multiple drugs they can choose from the recommendation. So it will be a very helpful for the doctors to get the assistive recommendation for the patient well-being. Okay, so we are considering it. We don't have any further query. We are considering at it's fine for everybody to understand on the CDSS part. Very soon, as I spoke, very soon we will be starting state-wise training also. We will be circulating the link with all the states and we will be conducting a region-wise. So very soon we'll be coordinated through the state coordination team. They are setting up the NHA. Thank you so much. I think Dr. Dev, we can conclude this session for today. Thank you so much, all the respected doctors and the participants from the region for your active participation and getting the understanding for this new initiative. Definitely, Hirendraji, we will share the PPT. It will be shared by state coordination team. We will be sent out to them and they will share with the respective regions. So you will get your PPT very soon.
Thank you, Dr. Amandeep. Thank you, everyone.
Thank you, everyone.
Thank you so much, everyone.